Mi gente, we need to talk about what just happened with a pregnant woman being deported and why this is part of a much larger disturbing pattern. A 21-year-old woman, 8 months pregnant and in medical distress, was deported from Atlanta to Colombia after asking repeatedly for medical care. She was experiencing severe abdominal pain, nausea, and vomiting, and according to reporting, she was denied treatment before being put on a plane. Now, here's what ICE doesn't want people to focus on. They have an actual policy. ICE Directive 11032.4 that says pregnant, postpartum, and nursing individuals should generally not get detained or deported, except under extremely limited circumstances. And when they are in custody, they are supposed to receive regular medical monitoring and care. But this policy is clearly not being followed, and we know this because this is not the first time. In 2025, multiple women in ICE custody lost their pregnancies. One case involved a woman known as Alicia in Louisiana. After being detained, she experienced severe abdominal pain and heavy bleeding. She was taken to an emergency room, told she had miscarried, and she returned to detention the same night, where she continued bleeding for weeks without medical attention before being deported. Another case involved Lucia in Georgia. While detained at the Stewart facility, she reported heavy bleeding and cramping. She says she was left alone while bleeding, later taken to a hospital in shackles, where doctors confirmed she had miscarried. These are not isolated incidents. This is a pattern. And here's the questions that need to be asked. Where are the so-called pro-lifers? Where is the outrage when pregnant women are denied medical care? Where is the concern where pregnancies are being lost while in government custody? If this were really about protecting life, this would be unacceptable. But the silence tells us what this has always been about: control, punishment, and who is deemed worthy of care. Pregnancy is not a loophole. It is not a bargaining chip. It is a medical condition that requires care. And when a government agency repeatedly puts pregnant people in harm's way, despite having policies to prevent exactly this, we have to call it what it is: systemic cruelty. This isn't just about immigration. It's about whether we're willing to accept this level of dehumanization as normal. Because once it's normalized for some, it becomes possible for everyone.